Today we're going to talk about how to monitor an Inspire case. Inspire is a device used in sleep apnea to push the tongue forward when the patient snores. During the case, we will be monitoring the hypoglossal nerve, cranial nerve 12. This is the Inspire device. It consists of a control unit, a cuff that goes around the hypoglossal nerve, and a sensor that detects snoring. The surgeon exposes the hypoglossal nerve under the chin, tests the branch of the nerve that he wants to use, places the cuff around the nerve, and then implants the control unit and sensor in the chest wall. Here are the muscles that we will be monitoring during the case. The surgeon will place the recording electrodes at the start of the case. The recording electrodes are bipolar, 2 wires on each electrode. The wires, an active, and a reference for each bipolar electrode will be handed to you. We will be recording from 2 muscles, therefore you will be using 2 channels of your cascade. The first muscle will be the genioglossus muscle. This muscle extends the tongue. In other words, it pushes it out. This will be the muscle that we want to see activated when the surgeon stimulates the hypoglossal nerve. The branch of the hypoglossal nerve that activates the genioglossus muscle will be the branch that he wants to find to place the cuff around. It is at the base of the tongue and will be near the floor of the mouth. The second muscle will be a mixture of the hyoglossus and styloglossus muscles. These flatten and retracts the tongue. The electrode for these muscles will be on the lateral aspect of the tongue. When the surgeon stimulates the branches of the hypoglossal nerve, we ideally want no response in these muscles. Remember, the goal of this surgery is to have the device extend the tongue when it fires. So we want to help the surgeon find the branch that activates the genioglossus muscle. We do not want to activate the styloglossus or hyoglossus muscles, which work against extension of the tongue. Here is the stimulating electrode. It is a bipolar stimulator, so both wires will be plugged into your stimulator box, 1 positive and 1 negative. The polarity doesn't matter. Here are the stimulation parameters. Stimulation is through a bipolar stimulator. You will limit the stimulation intensity to 20 milliamps. The pulse width is 250 microseconds. You will increase the stimulus intensity until you get a robust response. Here are the recording parameters. Like I said before, we will be using 2 channels, one for the genioglossus muscle, the second for the hyoglossus styloglossus complex. The time base is 2 milliseconds per division. The high cut filter is 10,000 Hz. The low cut filter is 100 Hz. The amplifier gain is 2,000 microvolts per division. The screen sensitivity or screen gain should start at 1,000 microvolts per division. Increase or decrease this value until you get a good picture on your screen. Here is what your home screen should look like. There is a live EMG window on the left and an evoked EMG window on the right. The live EMG window is used to monitor for nerve irritation. The evoked EMG window is where you will see your evoked activity when the surgeon stimulates the hypoglossal nerve. The first channel is the genioglossus muscle. The second channel is the hyoglossus styloglossus muscle complex. While you are performing the hypoglossal nerve stimulation, the surgeon and the Inspire rep will determine what the waveforms show. However, it is important that you know what constitutes an acceptable response. Here are 4 sets of waveforms that you will encounter. Waveform A is the ideal response. There is a response in the genioglossus channel and no response in the hyostyloglossus channel. This will extend the tongue. Waveform B is what you don't want to see. Here there is no response in the genioglossus muscle and a response in the hyostyloglossus channel. This will retract the tongue. Waveform C is not ideal but acceptable. There are responses in both channels. However, the response in the hyostyloglossus channel is most likely a far-field response from the genioglossus. Waveform D is a mixed response from both channels. It is certainly not ideal, but sometimes it is the best you can get.